Hello friends, welcome to this special episode of CNS, where we will be in conversation with a very special guest. He is none other than Professor Dr. Surya Kant, Head of the Department of Respiratory Medicine, King George's Medical University, Uttar Pradesh, Lucknow. Dr. Surya Kant wears many caps and has been the president of many apex medical and professional bodies, including chairman of UP State and North Zone Task Force for National TB Elimination Program. He is the brand ambassador for COVID-19 vaccination of National Health Mission, Ministry of Health and Family Welfare, Government of India, and member of the Special Task Force for COVID-19 control. He is also one of the icons featured on India's very famous magazine, India Today. Welcome, sir. You have been at the helm of affairs for COVID-19 response in UP and also the brand ambassador for COVID-19 vaccination. So we would like to hear from you. Firstly, was there any COVID vaccine hesitancy in the healthcare workers in the hospitals in Lucknow and elsewhere?
Okay, Shobha, thank you very much, and thank you, CNS, for getting this wonderful opportunity for interaction with the audience and viewers of the CNS. And it's always wonderful to interact with you. You are the marvelous anchor, I would say. And I would, before commenting on your answer of your question, I would just highlight that India has fought very vigorously, effectively, and successfully the fight against COVID-19. And in India, UP being the largest state of the country with 250 million population, I think it is one of the largest country, I would say, in terms, although it is a state, but it is the country in terms of the population. And UP has been on the top of the list as far as the COVID management is concerned, as far as the COVID vaccination is concerned. And the success story behind is that we were the first state, not only in India, but throughout the world, which opted for the ivermectin-based treatment protocol as well as the prophylaxis protocol. Probably this was one of the success story, one of the regions of the success story, besides so many other things that the government efforts, administrative efforts, the efforts by the doctors, efforts by our team. So with this background, I would say yes, to begin with, on the 16th January 2021, when the vaccination program against the COVID-19 was launched by our Honorable Prime Minister, Shri Narendra Modi ji, and Dr. Surya Kant was fortunate enough to be vaccinated on the first day of launching of the vaccination program. Probably that was one of the reasons why National Health Mission chose me for the brand ambassador for COVID vaccination. And honestly, I would say that to begin with, there was a lot of hesitancy. What to talk of hesitancy in the general population, in the community at large, there was a hesitancy among the doctors, nurses, paramedical staff, or healthcare workers, security people, and even our administrator officer related with the health services. So this was the real challenge to begin with. And when National Health Mission asked me that, Dr. Surya Kant, you have to clear all the confusions. And then I said, please go for vaccination, not for the virus. Choose the vaccine, not the virus. This was my slogan. So with this, I started this slogan. In Hindi, I said, vaccine ko chuno, virus ko nahi. In English, it is said to be that, yes, choose the vaccine, not the virus. So this campaign was very effective campaign through the media, social media, and various platforms of National Health Mission, UNICEF, the Ministry of the UP government, and so many NGOs, especially I would mention the Rotary International. So they all helped me for the, convincing the people for COVID vaccination. Another reason was that after a few months, the second wave of the COVID came. I would not say that it was a reason for the enhancing in the COVID vaccination, but it was a major trigger, I would say, that when people get affected by, majority of the people affected by the COVID during the second wave, and the mortality and morbidity, the severity of the disease was also very much during that COVID wave, that fear helped us in increasing the compliance of, or you say, the removing the hesitancy for the COVID vaccination. So I think this is the story of agitation, and agitation is not only in Uttar Pradesh, in Lucknow, but this agitation problem was pan-India. Yes, certain states, for example, Kerala. Kerala is the one of the most literate state in the country, although having very small population, only 20 million, and we have 250 million, so more than less than 10% population is there in Kerala, but the health infrastructure is there. Very good health infrastructure is there. Literacy is around 100%. And of course, the advocacy and the communication was very strong as far as the vaccination program is concerned in Kerala. So I would compliment that to begin with, the hesitancy was less in Kerala, or the state where the education rate or the health infrastructure was higher. But in UP, although we were having a vast majority of the population, and our health infrastructure also was not too much developed, and there was a lot of hesitancy. But the nutshell is that ultimately we got the good coverage of the vaccination program. And right now we have that the UP has got 20 million people vaccinated till date. Not only 20, sorry, it is the 390, yes, 390 million doses of the COVID-19 vaccines have been given in Uttar Pradesh. If you see the Indian scenario, then in Indian scenario, more than 2 billion doses has been given for the COVID vaccine, including the first dose, second dose, and precautionary dose. Yeah.
Okay. What were the reasons for this hesitancy in the healthcare professionals and all 100% eligible healthcare professionals not opting for the vaccine, be it the first dose or second dose? Yes. What were the reasons?
Yeah, you got the very important point. It was not hesitancy on the population, general population, it was hesitancy in healthcare workers also. And the reason is very obvious. In an interview, I said that in this country, we never bothered for the childhood vaccination. You see the child, the born on the same day, get an injection here. This is called BCG vaccination, vaccination against the tuberculosis. On the first day of his birth, he cannot express his feelings. He cannot complain. He is not able to speak anything. And that's why you get a vaccination. So you are very much particular, very much punctual, and very much sincere about your childhood vaccination. You never raise the question against the childhood vaccination. Why? Because for years together, you have witnessed that these vaccines, they work, they protect our children. But problem was that this was a new vaccine. And that's why there are a lot of apprehension, fear, you see anxiety was there. What will happen if this new vaccine, somebody says that trial is going on, and during the trial, you have been usually exposed for the vaccination. And a lot of, you see murmurs, and you see the rumors were also created. Somebody said that it is given premature approval. I would not take any name, but somebody said that the vaccination has been given a premature approval for the public. This is only in the third phase. The all phases they have not covered of the trial, which is the principle of the clinical trial. But that was the emergency use authorization. So the Drug Controller General of India, and luckily I'm the part of the expert committee of Drug General Controller of India also. So I witnessed the all meetings, all proceedings of the approval of the COVID vaccination also. And I said, yes, I have direct conversation with the DCGI of India also. So I can say that there is a provision, internationally provision, that yes, emergency use authorization can be given if there is a necessary, there is an emergency, and there is a priority for any vaccination. So that's why the vaccination was very controlled, supervised, monitored vaccination. So this was the emergency use authorization, which is an international recommended procedure. It's not an unusual procedure. No norms have been broken, as it was spread that time that the protocol has not been completed, the trial is not completed. Why are you giving with the trial only a few thousand people? So internationally, already people have taken the vaccine, because UK was the first country to start the vaccination program, and then of course USA, and then we were in the, of course, the pipeline for the vaccination program. Luckily, we are very much thankful to our doctor fraternity that within the stipulated time, they developed our own vaccine, indigenous vaccine. That's a very important landmark in the history of healthcare system of the India. Because if you see, the development of the vaccination program earlier, it took more than 50 years to develop a vaccine for some vaccine. Edward Jenner was the first scientist who developed first vaccine in 1897, in the last decade of the 19th century. And since then, a lot of vaccines have been developed, and some vaccines took a lot of time for the development. But this time, India was also on the top of the list of the countries who developed their own vaccine. So I would say that we developed a strategy. We did a lot of advocacy. We did a lot of media campaign, media awareness with all kind of print media, electronic media, and social media. And of course, the effect of the second wave also. So these are some triggers and factors which contribute that, yes, a little bit hesitancy was in the healthcare worker also, because I mentioned that there was no experience of this vaccination. Later on, when my director, you see, when I took vaccination, I still remember the day on 16th January 2021. I just vaccinated, and when I came out of my room, more than 20 flashlights and camera were there with a live Aaj India TV, every news channel. And without, you see, recommendation was that after vaccination, you take half an hour rest there. So without waiting any time, and you see, I was not allowed to even a 5 seconds to say that, please allow me to take some rest. They asked me, they bombarded me with question and said, Dr. Surya Kant, we are on live. You are throughout the India. You have to, kaisa lag raha hai? How are you feeling? So, Aman, that was amazing thing, thrilling. I was also a little bit hesitant that if something happens to me, suppose BP is low or fainting attack is there, what will happen in front of this national media? So anyway, thanks to God, of course, the media is media. You see, you are also media. I can't say anything. That they were also confident that Dr. Surya Kant will come and have vaccination and will have nothing. I think this kind of confidence they were having. So I was interviewed just after the vaccination, and it was live throughout the country, rather beyond the country, because they were all media. You just name any channel, more than 20 new channels were there at that time. So, Aman, that helped me a lot. Because next day said Dr. Surya Kant dared to have vaccination on first day, and Dr. Surya Kant working. Next time they take interview, Dr. Surya Kant, have you any problem? No. You working? Yes, sir, I working. I'm doing it. So luckily on the next day I was having OPD and emergency also, and I didn't take any leave. So that was message given to all healthcare workers, and that scared the hesitancy in the healthcare workers. If Dr. Surya Kant can be vaccinated on first day and still he is doing without taking any leave, so why can't we? Then of course the healthcare workers, they come out, and then of course everyone took vaccination. So that was the story of healthcare workers.
Yes, that is important. Like you show by example.
This is saying, theory, the practical is more important than theory.
Yes.
So
exactly.
I said, I personally get vaccinated and I'm not having any problem. And this repeatedly, I gave the interview to the various media. And that message, of course, percolated to the healthcare worker also and the community also.
Doctor, was there vaccine hesitancy? Did you come across vaccine hesitancy in communities, like for various reasons? What were the reasons?
Yes.
Was it different from community to community, place to place? And
yes.
What were the main reasons due to which people were not opting for the vaccine, some of them at least?
You see, to begin with, there are a lot of rumors. Somebody said that if you get vaccination, you will become impotent. You won't be able to have the children issues. If you get vaccinated, you will feel weakness. You will get vaccinated, you can get the heart attacks. You can get so many other problems. So these were the rumors. So, and especially those who are less educated, especially the rural area people, especially the people living in the slum areas, especially the daily wage workers. You see, the person who is permanent employee and getting salary per month, he's not worried about of his illness or whatever it is. He's covered. His leaves are there. Everything is there. He's not hesitant that the salary will be cut or he was not have. But those persons who are daily wager, they earn daily and then spend daily. So if they are hesitant that if I fell ill for 2 days, what will happen to my family members? How I will manage the food and everything as they are the daily wages. So this hesitancy was more prevalent in the temporary workers, daily wage workers, laborer class, slum area people, rural people. And overall the different kind of rumors were there. So this was really challenge for us, the people like the brand ambassador and or the advocates of the COVID vaccination, for the whole health machinery system, the administrative system, the political system, the government system. This was really challenge. And then, of course, the various radio talks. I would mention the All India Radio. You see, All India Radio daily did a talk on COVID, and most of the time I was at least once or twice in a month I was called on live aired on the All India Radio, and they had a lot because the if you see the radio coverage versus the TV coverage, the radio coverage is very much at the outreach level. If you go to the remote village, remote hilly area, even if you go to the travel area, so you will have a transistor, the radio, and even the people can start on the mobile. Even the non simple mobile, that is the not a smartphone, they will also have the facility of to have to listen the news and of course the radio talks. So that also helpful. Although different FM channels also they also involved, but I personally have the very good experience of the All India Radio. That they for more than 2 years, I think when we completed the more than 200 crore doses or 150 crore doses at such landmarks also they have a special program. So they continuously hammered on the advocacy and awareness of the COVID vaccination program. So really credit goes to the All India Radio, and all of course I would thank to all the media personnel, print media, electronic media and social media, that they help a lot for propagating all these things. So I'll help to the various NGOs also who shows the video. They make the video of my vaccination and they showed that, see, this is Dr. Surya Kant 2-minute video. Just see 2-minute video. 2-minute video, you will see that the COVID vaccination is safe. So that 2-minute video was equally to like a 2-wound polio, people's polio like program. So this was the video shown by the different NGOs and the or community organizations, I would say, to the village and especially in the slum area and rural area. So I think that was you see really involvement of the governmental organization and non-governmental organization and media. This was a triangle. So media, including print, electronic and social media, the government system, the government political system, administrative system, health infrastructure, everything. And third thing is the non-governmental organization. So I think this triangle help us for the advocacy and this help in, of course, reducing the hesitancy.
You have been at the helm of affairs. You have been at the center of this COVID response. So from your experience and the lessons learned during the pandemic, of course, it is still there. The virus is still there. Could you share your insights for better uptake of vaccines in the future and better pandemic preparedness? For example, yes, should the campaigns to build confidence of people, should it have started earlier before the vaccines were rolled out? What are your insights into these?
So I will share my UP's experience and my personal experience. So I will answer the second part first and first part later. So regarding the preparedness, if you see, to begin with, when the cases were very low, less than 500 cases per day in country, and the lockdown was imposed, so there was a lot of fear. So I think for the preparedness of any catastrophe or any pandemic, you require a little bit fear, but not too much fear. This is lesson learned number one. Now, what happened that during quarantine, when the people were asked that, yes, you are of course, you have to be quarantined for 2 weeks and you will be there, of course, outside your home, in the schools or temporary makeshift arrangement for the quarantine. And people used to jump down from the roof. People ran away from that quarantine center. They thought that they are not being quarantined, they are being jailed. So what happened? The people hide their symptoms. Do you have any fever? Any family member? No, I don't have the fever. I don't have the sneezing. I don't have the no symptom is there. No COVID patient here. So people hide the symptoms. So there was a fear and fear psychosis regarding if you found positive, you will be quarantined to another place for 2 weeks. You will be away from your family members. If something happened to you, no family member will be able to connect you and I think this was a very panic situation. So I think we require a little bit to create a little bit anxiety in the people, a little bit fear in the people, but don't create the panic and don't be too much of projecting the fear. So this is the second, of course, lesson done. The third thing is, which is a very good thing. Personally, I feel that whenever there is a jump or rise in the cases of COVID-19, the UP government picked up some stalwarts of the respiratory medicine, pulmonology, or the critical care illness, and they make the, of course, a team. For example, a bureaucrat, a medical expert, and a technical expert, and they sent to. For example, first time there is an upsurge in the Agra, and I was sent as a first man from the King George Medical University for controlling, reviewing, monitoring the COVID situation in Agra. So, and this was the lockdown period. This I'm talking of May 2020. This was the lockdown period. And when I entered the Agra, you see lakhs and little people came to Agra for visiting the Taj Mahal, but there was no even animal or bird on the street. What to talk of human being. So, but for 1 week I stayed there, and the government arranged everything. I stayed in Circuit House and have the all facility from the DM and Commissioner of Agra. And we coordinated with the DM Commissioner, this Chief Medical Officer of Agra, and reviewed for that. And this policy works. So this, after this Agra experience, I was sent to Kanpur, then Meerut twice. And then during the second wave, you will be surprised to know, Shobhaji, that I was chosen as a single member committee to send Varanasi during the second wave, the constituency of the Prime Minister Narendra Modi. So I don't know whether this was my fortune or this was unfortunate. Thanks to God again that we were successful in controlling the situation in Varanasi also. But if I would have failed, suppose, imagine what will happen. But this policy worked. I think with the Agra experience, Kanpur experience, Meerut, the government has already realized that if you send an expert, this works, because expert have learned a lot of things during that COVID times. So that policy, that coordination with the administrative officer, the nodal officer, the chief medical officer, and the expert, this works. So I was reviewing the whole situation in Varanasi also, and that also within 3 days, the morbidity and mortality went down. So I think this lesson learned is that you must use the expertise. Only administrative, official, or administrative system will not work. So third lesson for the preparedness, future preparedness, is that you must use the services of the expert. Another thing is the capacity building. What I learned during the COVID time, that we Indians have immense potential to act, to develop, and to work during the emergency. Now, if you see one example, I would say that in January 2020, when the COVID pandemic started, we had only one virus lab in the country, only one, that is National Institute of Virology, Pune. Now, what happened during time, that during 1 year, this one lab jumped to the more than 3,000 labs throughout the country. See the fastness and the pan-India UC approach for developing the virology labs. So this was even in King George Medical University, to which I belong, first the sample was collected here and then it was couriered to the Pune. This happened. But within 2 weeks, we transformed our simple virology lab into the expert virology lab. And then we started, first day, 60 sample only per day. And within 3 months, we reached from 60 to 6,000 per day. So this was of capacity building. So during preparedness, we take the help of the expert and we should see that what are the various areas, what are the various gray areas where we are lacking in terms of viral pandemic, bacterial pandemic, parasitic pandemic, or any pandemic. So I think we have to have a continuous process of churning, continuous process of discussion with the expert, that what segments of our health infrastructure they are lacking. Similarly, I will give you the example of PPE kit. There was no PPE kit production in the country. And Later on, we become the second largest producer in the world. Third thing is about the ventilators. No company in the country was manufacturing the ventilators. And now more than 8 companies are manufacturing the ventilators in the country. So, Aman, this was the tremendous capacity building. So, as a part of preparedness, I would say that capacity building in each and every aspect of the health infrastructure and facility should be a continuous process. We should not wait a pandemic to result into a crisis. So that is the, I think, lesson learned. Shobhaji, I'm not able to hear you.
Yes, sorry, I was muted. Yes.
Yeah.
What about the awareness campaigns? You said you would refer them. Should they start before the vaccine rollout so that people are better informed and better prepared?
Yeah, this is. I think
trust?
this is one of the best questions you have. Actually, our mind setup, including me, our mind setup was that vaccination is not a new thing in this country. For so many years, we are running a largest program of the vaccination in India, and even children we are vaccinating. What will happen to this COVID vaccination program? We took as a routine vaccination. So this happens to the mindset of we, the doctors also, probably the administrator also, and probably the policymakers also. So this was a mistake from all of us. I accept that this was my mistake also, that I also consider vaccination is not a new thing. Even one day a born child, that's also he's being vaccinated in this country. So vaccination is not will be an issue. But this became a major issue. This was the major challenge for us. And this took a lot of time, lot of money, lot of you people to involve that advocacy and awareness. So I think this was mistake done by every. Nobody can guess. Even media couldn't guess. The administrative officer couldn't guess. Politicians couldn't guess. The expert couldn't guess. Nobody can guess. So yes, we learned a lot because this was our committed mistake. We should have started earlier. That vaccine, what is the efficacy of vaccine? What is the effectiveness of the vaccine? What is the advantages of the vaccine? This spread should have started earlier.
And also, for whatever reasons, I feel that in India and maybe other countries as well, adult vaccination has always taken a backseat. Yes, child immunization is there. But even now, if you talk of adult vaccination, that has not gained ground. But I think it is equally important for several infectious diseases, adult vaccination.
Shobhaji, it is the real ground reality, I would say, that we are running for more than 1 decade. I'm involved in the influenza vaccination for my all asthma patient. I'm a lung specialist, and that's why I become the corona specialist also, by virtue of lung specialist, because corona hits lung the most. And we are running for more than 1 decade the pneumococcal vaccination and influenza vaccination program for the adults and elderly. Now see, the status of this program is that even the doctors having diabetes, asthma, COPD, or they are elderly, because this vaccination program is running for all the elderly people, all the asthma and all respiratory ailment people, all the patients of having chronic diseases like diabetes, heart and cancer, or liver disease, or lung heart disease, kidney disease, and all those patients who all the persons who are 60 plus. But you will be surprised to know that even healthcare workers having asthma, they are not getting regular vaccination. So we just have to review this situation, that adults and elderly, for running a vaccination program for adults and elderly is a real challenge in this country, not only this country, but throughout the globe. Because we having the mindset, the society is having mindset, the vaccination means the childhood vaccination. There is no concept of adult vaccination. There is no concept of elderly vaccination. Yes, some diabetics, some asthmatics, COPD, they think that yes, their expert is saying that regular vaccination is important for their influence, for their disease, because otherwise they will have heart attack, they will have the lung attack, they will have asthma attack, they will have COPD attack. So this apprehension and of course the agony is there among the patients. And of course, most of these chronically ill patients, they are now vaccinated with the pneumococcal vaccine and influenza vaccine. But I do agree that adult vaccination and elderly vaccination is a real challenge.
How can we not talk of lung health when we are talking with Dr. Surya Kant? Dr. The Global TB Report 2022 has been out recently, and it shows that the burden of TB as well as the drug-resistant TB or MDR TB has increased globally, including in India. And also the MDR TB treatment success rate in India is around 57%, as stated in the report. This shows that we have failed to prioritize infection control to prevent transmission. And also rational use of latest available drugs is not up to the mark, which could further fuel drug-resistant TB. What is the way forward, according to you, to tackle drug resistance in tuberculosis and other infectious diseases?
Shobha, if you see the targets of Sustainable Development Program, the base of the statistics is taken from the year 2015. So every time, whenever we compare from 2015. And for every 5 years, they have set the target for 2020, target for 2025, target for 2030, target for 2035. Now, if you see what happens in first 5 years, from 2015 to 2020, the control of disease, control of mortality, and control on the cost for the disease treatment. All three factors, when they were reviewed after 5 years in 2020, they're hardly 9%, 11%, or 23% target completion. Otherwise, there was no target completion. So I think to begin with, we are lagging behind for the TB elimination program. The second blow came after 2020, that roughly 2 years they have literally, I would say, wasted, because all health resources, infrastructure, manpower, they all have been diverted for the COVID. There was no DOTS worker, there was no UC lab technician, or there was no district TB officer, no medical officer. They are available for the TB program. They were all diverted, overburdened with the COVID program. The only revival came when, after 1 year, there is a, of course, advisory from the Ministry of Health that now you should screen both COVID and TB. And till then, the loss has occurred. So that was the problem, that the diagnosed people, they could not get the proper treatment. The symptomatic patient, they could not be diagnosed, and they continue to spread the disease. Now, the here question is, very simple situation is to understand that if a sensitive TB patient coughs, it releases 3,500 bacteria in single bout of cough. And one bacteria is enough to cause the disease. Now, what will happen? If a person of sensitive TB will cough, it will release the sensitive bacteria. If a person of MDR TB or XDR TB will cough, it will not release the sensitive bacteria. It will release all 3,500 bacilli, which are having MDR bacillary population or XDR bacillary population. This is the reason that during the COVID period, all drug resistance cases who were either not diagnosed properly or not treated properly, they continuously spread the diseases in the society, especially the household contact. And inside the home, nobody was having the mask. And I would comment on mask also. You see, the COVID virus is of 5 micron in size. If you see the tuberculosis bacteria, this is of 125 micron in size. So TB bacteria is, reverse is there. TB bacteria is smaller than the COVID virus. COVID virus entry can be prevented with the mask, but effective, the entry of the or transmission of the tuberculosis bacilli, this can't be done by mask. Mask is only 30-35% effective if even patient or attendant are wearing the mask for the tuberculosis transmission. While if you see the COVID transmission, If the patient and attendant both are wearing the mask, the reduction in transmission of the COVID virus is 97%. So 35% versus 97%. So even mask, which was considered as that it will also protect that TB transmission and COVID transmission, that was not the effective way. It helps a little bit, but it did a lot of transmission during the time. And that's why the 2022 data is showing jump upsurge. And the second thing is that during the COVID times, we didn't able to do notification also. Now we are doing notification for roughly for all the cases. So now the real picture is emerging. So that is all the reason. Number one, increase in transmission during the COVID time, the sensitive with TB as well as the drug resistance TB. Number two, we could not do the notification on the Nikshay portal, and that's why we didn't have the real data during that time. Now we are having the real data time, a real database, and that's why the cases have been appears to be increased as well as mortality appears to be increased. But I'm sure that within a year, notification may go up, but mortality will go down because now we have started effective period. You said about the availability of the drugs. Yes, it is the issue, especially the drugs, the bedaquiline and delamanid, which are the drugs for the treatment of MDR TB and extensive drug resistant TB. Still, we are facing a lot of challenge because now there is an upsurge in the drug resistance TB and there is a problem in the demand and supply chain mechanism. You see, first, internationally, the drug has to be transported to the country, and then there is a national store. Then it is distributed at the state stores, and from his state store, this is being, of course, supplied at the district store, and from the district store to the all nodal drug resistance TB center or drug resistance TB center. For example, in Uttar Pradesh, we have 24 nodal drug resistance TB center. King George Medical University is also our nodal drug TB resistance center. 56 drug resistance TB center. So at 56 drug resistance TB center and 24 nodal drug resistance TB center, it is a huge Herculean task to maintain the demand supply chain of these drugs. Another thing is that now more and more, rather, I would say that almost all cases of drug resistance TB are being diagnosed, are being notified. So there's a rapid upsurge in the demand of the drugs in comparison to the previous 2 years. And second thing you said, efficacy of the drug resistance TB treatment. Yes, I agree that roughly there is only 56% success rate of the drug resistance TB. Now, this is the real challenge, and we are working on that. Now, as we are the center of recent drug trial for the 3-drug regimen for the treatment of multi-drug resistant extensive drug resistant TB, and I'm the principal investigator here for that trial. This is the Indian Council of Medical Research trial. And if this trial succeeds, and the result will come after 1 year or 2, and if this 3-drug combination can reduce the duration of treatment to 6 months or so, then of course it will be a great success story for the drug resistant TB patients. And then efficacy will be, because to continue the treatment for 1 year or 2 years, it's also very, very important challenge because people, however, the nutritional support program in which we are giving the 500 rupees per month to the patient, this is a very important aspect for the adherence to the treatment also. People think that if I stop the treatment, the money will not get transferred to their account. So it's a very wonderful thing. Although this is for nutrition support, but byproduct is that adherence is going up. So I think such kind of support is also required and timely, and that will help. Number one positive thing which I can see. And the second thing, our governor, Srimati Anandiben Patel, she has started a unique program for the adoption of TB patients. I don't think this is a very unique program globally. It started in our Uttar Pradesh, in Lucknow, and we were the first to, of course, obey this program or comply this program. And our Department of Respiratory Medicine has adopted more than 100 children of TB patients suffering from TB. And governor herself has adopted so many patients. And recently on the occasion of World TB Day, there was a program of adoption for the TB patient, and more than 84,000 patients of TB were adopted on the same day. And now we have adopted lakhs and lakhs of patients. And what is the purpose of this TB adoption program? I will speak half a minute on that issue because this is very particular to me. This is very near heart to me, and thus it's touching because it has started in our state, Uttar Pradesh, and in Lucknow. So there are, according to, when I analyze this TB adoption program, I think there are 4 objectives of this program. Number 1, TB is not only a disease, it's a social stigma also. I think as a media person, you will accept that TB is not disease compared to other diseases. It's a social taboo. Still, especially the targets are females. Females are being divorced, separated by their husband. The gender bias is there. They are not being given proper diet. They are not being given proper attention. And they are being targeted by the society. Children is the second. If your child is suffering from TB, even your the family members or the family children, they will not sit together. They will not study together. They will not share the meal with that child. Even your relatives, they will not allow their children to play with your child. This is social TB, especially for the ladies and especially for the children. So they require emotional support. If you adopt the TB children, this means you are providing an emotional support to your TB patient, number 1. Second thing is you provide extra nutritional supports. For example, in a packet, you are giving the pulses, some fruits, the other dry fruits and other items. And if the patient is child studying in a school, so you are giving the pencil, stationery, etc. support. So such kind of nutritional support, emotional support, and social support. These 3 supports are the instant support whenever you adopt the patient. And the 4th support, which I advocate, till now it is not part of the TB adoption, but I advocate, for example, a rickshaw puller developed pulmonary tuberculosis. He was treated properly with very good standard drugs. But at the end of the day, 1 lung get destroyed. 1 lung get damaged. Now he is bacteria free. He's declared TB as a cure, but his 1 lung has destroyed. Now this rickshaw puller will be able to pull the rickshaw? No. He will breathe whenever he will have heavy work. Exertion. So now he needs from rickshaw pulling profession to convert him into e-rickshaw pulling. So we need a vocational support also so that we can convert such patient from the heavy worker to the sedentary worker or simple work. I mean, this is my personal policy. This is my personal thinking. This is my thought that I have started propagating in the Lucknow and Uttar Pradesh and in all 9 states to which I cover as a North Zone chairman. So I think this idea which I started that we also need, although this is not a part of our national program or state program, but I think first time I'm sharing with any media. So I'm really proud that Shobha ji and CN is taking my interview. I'm sharing my thoughts that we need a vocational program also, vocational support also. And now most of the people from the corporate sector as a corporate social responsibility, I request with the folded hands to the all corporate social corporate people that they should come forward as a part of corporate social responsibility, and all NGOs to come forward, and media should come forward to raise the voice of these patients who develops the lung damage after the treatment of pulmonary tuberculosis. They have been declared cured by the program. They will write on the that TB card that yet you have been declared as a cured patient. Now, what will happen after that? We have to see that whether the patient has normal lung function or abnormal lung function. If he's having abnormal function, damaged lung, then he needs vocational support, especially if he is having a intensive labor work. So, and I think we have to do vocational support also. So I propose this on CNS and to you that my idea should also be advocated throughout the world, that we should come forward for the vocational support to the TB patient also.
Yeah, agree with you completely, Dr. Saab. And this has been our thinking also, that this
we are having same frequency, same wavelength.
Yes, yes. Just one clarification. You were talking of the 3-drug regimen for TB. Are you talking of the BPAL regimen?
Yes, I'm talking of the BPAL. Yes.
Okay.
So 3 drugs combination, the Vidaculin and
Protaminate,
Protaminate and Linezolid.
Yes. So you are having a study, or you are having some study
Yeah,
on
our center is part of that.
Okay, okay. So many thanks to you, Dr. Surya Kant, for this very informative talk and for your valuable inputs. Friends, we were listening to Professor Dr. Surya Kant, Head of the Department of Respiratory Medicine, King George's Medical University, Lucknow, and Brand Ambassador for COVID vaccination. Thank you very much. Have a good day.
Thank you,
stay
Shobha ji,
safe.
and thank you all the viewers of CNS. Thank you very much.
Thank you very much.